Hi, this is Brian Kim. I'm going to share with you this case of an iStent inject W placement and what to do when the second stent placement fails. And so in this case, the first stent went well, but the second stent, I had some trouble and it didn't deploy and attach to TM and Schlemm's canal. And so you'll see what I do in order to successfully implant a second stent. If you want to know more about basics of iStent inject W placement, please see my Simuli Eye video where I show you using the model eye in my training for the iStent inject W. And so I've already turned the eye away from me. I placed a dollop of viscoelastic on the surface of the cornea. Again, the cataract surgery has already been performed. You can see my temporal incision. I have the gonial lens and now the device ready with the sleeve extended and covering the trocar. This is how you want to start off with the case. So I'm placing the device in the eye first, and then I'm placing the gonial lens afterward. Now I have a nice view of the eye. I'm now increasing my magnification and getting things into view. I'm able to see TM and scleral spur, which is good. As far as positioning of the head, I've retracted the sleeve by pushing down on the teal button and pulling it downward and towards me. You can see the trocar, the tube, and the window. You want to make sure the window is facing you so that you can see the trocar clearly and to make sure it's in the neutral position. I'm pushing the trocar into TM and doing a slight dimple so that it pierces into Schlemm's canal. You saw there I was hesitant, so I pushed in, but then I stopped, and then I go back, dimple in, and then deploy the device. Once it's deployed, you want to go straight back so you don't dislodge the device from TM and Schlemm's canal. In this case, there's not nearly as much exuberant hemorrhage compared to my first case, and I was able to actually tap the device to make sure it was actually seated correctly into Schlemm's canal. Once the first one is deployed, I push the teal button down and extend the sleeve to cover and protect the trocar, take the device out, hand it off to my technician. I'm turning my chair, I'm rotating towards the left so that I can have better access to the right side of the angle. I still have a very good view of TM and scleral spur, but I go ahead and push some more viscoelastic anyway to give myself a better view here. Because as you do the case, there's a little bit of OVD egress, and so it's good to start off with a very full chamber again. So I'm going in with the device, the sleeve is extended, I'm pushing down on the teal button and pulling it backward to expose the trocar and the tube. I'm able to see the window is facing me. I'm pushing the trocar into TM. I'm having a little bit of a dimple. I don't know if that's too much of a dimple or what, but I go ahead and deploy, but as you can see, it did not attach. And so now I have the device still in my hand attached to the trocar. So what happened? Well, number one, maybe the trocar wasn't in TM correctly, and so maybe I didn't pierce it, or maybe it was too high or too low, and so it didn't embed correctly. Or number two, maybe the trocar wasn't in the central and neutral position. Maybe it was in the correct position in TM and Schlemm's canal, but because the trocar was maybe tilted to the side or so forth, as it was going down the shaft of the trocar, maybe it met resistance against the wall. Or maybe number three, I didn't apply correct dimple pressure. Maybe I applied too much dimple pressure. As you saw, it did create quite a bit of a V. And so when you apply too much pressure, sometimes the device ricochets and then comes back out. Again, I'm not quite sure. I'm still fairly new to this procedure. Clearly, it's a little bit nuanced when you deploy that device and it doesn't go in quite consistently, and I'm still figuring out if it's my technique or what. The good news is the training takes this into account, and so what do we do now? When the stent is within the shaft of the trocar, you puncture TM and Schlemm's canal with the trocar like you normally do, and you perform the dimple test just like you would do on a virgin eye and a virgin stent placement. So with the trocar exposed and the iStent still on the tip of the trocar, I'm going to dimple into TM and Schlemm's canal. The problem is you can't actually visualize the tip of the trocar, and so this is a little bit of a challenge. So you just kind of trust that it's in position, you dimple and then you fire, and thankfully in this case it went well. There's not much blood, and so I'm able to see pretty clearly that it's in good position. I go ahead and take the injector out. I'm going to fill the eye with some more viscoelastic just to ensure that the position is good, and thankfully it's in great position. It's seated very well. And I'm just rotating the microscope so that I can see both stents in view with the gonio lens. You can see I have kind of wide spacing between the two stents here, and so that's probably more like 3 clock hours. And so I can see on the left, by pushing the viscoelastic out, that the stent is seated very nicely on the left as well as in the right. And so that's kind of a really nice view of both stents in place. And so again, with this case, a lot less blood, a lot less collapsing of the anterior chamber compared to my first case. And so I was quite elated and relieved that this went pretty well. Again, with the second stent, I did have an issue where the stent did not deploy correctly. Thankfully, it stayed on the trocar tip. It's a little bit of a blind pass when you're trying to pierce TM in Schlemm's canal when the trocar is not visible because the iStent is right over the tip. But you want to kind of trust the location. You penetrate where you think the trocar is and into TM and Schlemm's canal. You want to dimple as if it's a first time deployment. You want to press the black button and it should go forward and hopefully embed correctly. And so again, there's a lot of challenges, I think, with these procedures. It would be really nice if you push the button and it goes in perfectly, but I think there are a lot of nuances with positioning, with the subtlety of dimpling, and the positioning of the trocar, making sure it's not touching the sides of the wall of the tube. And so as I do more and more of these and I encounter more challenges, I'll be sure to post these challenging cases and show you how I handle them. So I hope this was helpful to you, and I thank you for your attention.